Hey 301ers, did you know that according to the Centers of Disease Control and Prevention, heart disease is the #1 cause of death in the United States? This study involves participants who have had a history of acute myocardial infarctions. Myocardial infarctions are caused by myocardial ischemia, which leads to myocardial necrosis or death of the heart muscle tissue. This results in the decrease of cardiac function. This study looks at the effects of continuous aerobic training and supercircuit training on cardiac function.
19 male post-myocardial infarction patients aged 47 to 69 years old were randomly designated to either continuous aerobic training or supercircuit training. The continuous aerobic training group CAT exercised at an intensity of 60 to 70% of their heart rate reserve. Their exercise routine consisted of 20 minutes on the treadmill, 15 minutes of cycling, and 10 minutes paddling on the hand cycle. Throughout their exercise, the modified Borg scale was used to measure rate of perceived exertion. The supercircuit training group exercised at a moderate to high intensity consisting of resistance and aerobic training. Each round consisted of 1 resistance exercise and 3 minutes of aerobic exercise, followed by a resting period. The circuit was performed 8 times. Each exercise, such as these, were used for the resistance portions of their exercise. Each resistive exercise was performed for 15 reps at an intensity of 30 to 50% of their 1 rep max. Treadmills, cycles, and hand cycles were used for a 3-minute aerobic portion of their training. Participants were asked to exercise at an intensity of 75 to 85% of their heart rate reserves. The resting period lasted for 1 to 2 minutes depending on the week of training.
Echocardiography was used to measure the participants' heart functions. The values measured were ejection fraction and the ratio between early transmitral flow velocity and early diastolic velocity at the lateral wall. Aerobic graded exercise tests were used to measure aerobic fitness using the Bruce protocol graded exercise test with the 12-lead ECG. Throughout the graded exercise test, the participants' blood pressure and rate of perceived exertion were also recorded. Hand grip strength was also assessed due to its correlation with heart disease risk. Quality of life was also measured using subjective questionnaires.
Both groups showed improvements in strength, which was measured by hand grip dynamometers. The SCT group had significant changes in pre- to post-test echocardiography outcome measures, specifically, a decrease in magnitude of the ratio between early transmittal flow velocity and early diastolic velocity at the lateral wall. In the SCT group, cardiac function improved in patients with reduced left ventricle function, and participants reported an increase in quality of life. There were no significant changes in the CAT group. A combination of both resistance and aerobic training has the potential to improve cardiac function,